Hello everyone, today I am going to talk about the common surgical positions. As you can see, the first position here is the supine position. It is the most common position used. It is also known as the neutral position, and head and foot end are at the same level. It is used for abdominal surgeries and breast surgeries except breast reconstruction surgeries. In breast reconstruction surgeries, we use the Fowler's position, and for taking the LD flap, we use the prone position. The position with the head end up and the foot end down is the reverse Trendelenburg position. It is used for surgeries such as laparoscopic sleeve gastrectomy and lap cholecystectomy. In lap cholecystectomy, the right end of the patient is up for easily accessing the gallbladder. It is mainly used for upper abdominal procedures as the bowel falls down. And in the lap chole procedure, the bowels we have to access the gallbladder, which is towards the right side of the body. This position, which you can see at the bottom of the page, is the Trendelenburg position. In the Trendelenburg position, the head end is low and the foot end is up. It is used for pelvic surgeries as the bowel falls towards the head side and we can easily access the pelvis. The position you can see at the top of the page is the lithotomy position. It is used for obstetric procedures, gynec procedures. It can be used for urological procedures like TURP, transurethral resection of prostate. It can be used for piles. It can be used for fissure surgeries. And the point to note here is that there should be adequate cushioning in the legs. Otherwise, it could lead to common peroneal nerve injury, which can lead to foot drop. This position is the Rose position. It is performed by keeping a towel under the shoulder blades of the patient. And the head end of the patient, the angle between the head and the body of the patient is 30 degrees. It gives an adequate field of surgery to the surgeon, and it also helps in giving a bloodless field. As it gives an adequate exposure, this surgery is used in thyroid operations like thyroidectomy. The next position is the lateral side lining or kidney position. You can remember the surgeries as it is used in the surgeries related to the kidney, like the pyelolithotomy, the nephrolithotomy, and the nephrectomy surgeries. It can also be used for other procedures like thoracotomy procedure and LD flap, that is latissimus dorsi flap, for breast reconstruction. The point to note here is that adequate cushioning should be done, otherwise over abduction can lead to brachial plexus injury. The prone position. The prone position is used for surgeries like spinal surgeries and pilonidal sinus or G. Piker disease, which is not used anymore, which is jackknife position. As you can see here, this is a jackknife position as it led to compression in the chest and there were many cases of positional asphyxia. As you can see, this is the Fowler's position or the sitting position. It is used for posterior cranial fossa surgeries and for breast reconstructions. It gives a bloodless field which is required for these surgeries. But the problem with this surgery is that if there is a cut in the veins, there is a vacuum formed which could lead to air embolism. To ligate the vessels before cutting them, or we have to do saline irrigation in the field to prevent air embolism. And even after taking these measures, or when these measures are not taken, it can lead to air embolism. If air embolism happens, we have to shift the patient to left lateral decapitous position with the foot end up, which is known as the Durance position or the recovery position. So the air which has got entered into the body will reach the right side of the heart, which can be aspirated by inserting a needle to the heart or to central venous aspiration under guidance.